This is a Module 3.2 on nutrition. The following presentation will give you information on nutrition in sarcopenia, its influence and importance in prevention and treatment program you create for your patient. Learning objectives of this module are: know the importance of nutrition in sarcopenia, be able to assess malnutrition, know the importance of protein and vitamin D, and know how to implement protein and vitamin D in daily diet of your patient. Poor nutrition is common in elderly, and many are malnutrition or at risk of malnutrition. Lower food intake with aging leads to weight loss, which has influence on muscle mass, strength, and physical function. Sarcopenia is associated with malnutrition. According to the European Working Group on Sarcopenia in Older People, malnutrition may be caused by low dietary intake, example starvation, inability to eat, reduced nutrition bioavailability, example diarrhea, vomiting, and high nutrient requirements, example inflammatory diseases such as cancer or organ failure with cachexia. On the other hand, proper nutrition has an important role in prevention and management of sarcopenia. Early screening and detection of malnutrition or undernutrition is crucial. The Mini Nutrition Assessment short form is a tool you can use when assessing the nutrition in patients above 65 years old. It has been validated in both the community and healthcare settings, and it's easy to use. It assesses patients' nutritional status in past, present, and future. To test the nutritional status in the past, you may ask about weight loss in the past. When assessing the present nutritional status, you may measure the BMI. This is explained in Module 2.3. And when looking for the future nutritional status, you should look for potential problems and ask about patient's appetite. Low score on this test correlates with decline in functional ability in elderly. Patient may score a maximum of 14 points. 12 to 14 points indicate a normal nutritional status. 8 to 11 points predict the risk of malnutrition, and those who score less than 7 points are considered malnutritioned. In 2008, the Society of Sarcopenia, Cachexia, and Wasting published nutrition recommendations for sarcopenia prevention and management. Most crucial components are protein and energy intake. Most important in preventing and managing sarcopenia are levels of protein and vitamin D. Dietary protein with its amino acids is needed for synthesis of the muscle protein. Moreover, these amino acids have a role of stimulating protein synthesis after feeding. There is rising evidence that synthetic response to amino acids may be blunted in elderly, making protein intake even more important. The most important amino acid is leucine. It stimulates the specific intracellular pathway which is associated with muscle protein synthesis. It's essential, meaning that it cannot be produced by body and has to be obtained through food. Sufficient amount of protein intake can reduce the muscle loss. Recommended dietary allowance suggests intake of 0.8 grams of protein per kilogram of body weight per day for healthy adults. Foods high in protein are eggs, almonds, chicken, cheese, milk, protein bars, etc. You can also recommend your patients to supplement their diet with some flavored protein shakes. To promote muscle growth, a protein should be taken 30 to 60 minutes after a workout. Vitamin D deficiency is the most common nutritional deficiency in elderly, regardless of their race and ethnicity. Low levels of vitamin D are correlated with low muscle strength. Sufficient amount of vitamin D is known to increase strength and function and decrease falls and mortality. The supplementation doses are considered sufficient once they manage to raise levels above 100 nanomole per liter. Foods rich in vitamin D are fish like tuna, salmon, cheese, eggs, orange juice, mushrooms, etc. Finally, spending more time in the sun is the best way to get vitamin D. This is the end of Module 3.2. Now proceed to the Module 3.3, where we will discuss about tailoring the treatment to each individual patient based on his or her condition.